Frank is very excited. He's off to Thailand. He doesn't have much time and he's gone along to Dr. Aida for pre-travel advice. Dr. Aida is a medical chatbot using ChatGPT. Dr. AI Doctor anytime. Good morning, Dr. Aida.
Good morning. How can I assist you with your pre-travel consultation today?
Yes, my name is Frank and I'm really excited because I'm going on a holiday to Thailand. And I want to make sure that I'm all prepared health-wise.
That's great to hear, Frank. Traveling to Thailand sounds exciting. Make sure you're all set for a healthy trip. Could you tell me your age and, if relevant, whether you or your travel companion are pregnant or planning pregnancy?
Love your work, Dr. Aida. Checking carefully that Frank doesn't have a pregnant partner, which has lots of implications for travel. Yeah, now look, I'm single and I'm looking forward to a great trip. I'm 42 years old and I've been working super hard, so looking forward to a great holiday.
It sounds like you're ready for a well-deserved break, Frank. Can you share with me if you have any underlying medical conditions or if you're currently taking any medications?
Look, I haven't got anything, but I have to say I got dengue fever in Bali about 5 years ago.
Thanks for sharing that, Frank. Having had dengue fever before does heighten the importance of mosquito protection on your trip.
Nice work, Dr. Aida. Good to pick up the dengue fever and make sure there's good mosquito protection.
Regarding your vaccination history, can you tell me about any vaccines you've received in the past, especially those for travel? And have you ever had any adverse reactions to vaccinations?
Look, it's always so hard to remember. Maybe you've got it in the notes, but I think I've had tetanus and I had the flu vaccine last year. And I don't remember what vaccines I've had in the past.
No worries, Frank. We can work with that. It's always a good idea to have your tetanus and flu shots up to date. For travel to Thailand, we'll consider vaccines like hepatitis A and B, typhoid, and possibly others, depending on your specific activities and destinations.
Sounds like a good plan, Dr. Aida.
Have you ever had any allergic reactions to medications, foods, or other substances?
No, not that I know of.
That's good to know. Now, let's talk about your trip. What's the purpose of your travel to Thailand and what kind of activities do you have planned? This will help us understand any specific health risks you might encounter.
Yeah, well, I'm just going to have a good time.
Sounds like a relaxing trip. For a holiday focused on socializing and beach time, we'll think about vaccinations for common travelers' diseases and also precautions for food and water safety. Do you have your travel insurance arranged for the trip? It's crucial, especially for access to healthcare if needed.
Yeah, I've got my basic health insurance up to date.
That's good to hear. Could you tell me about your itinerary in more detail? Specifically, when is your date of departure, how long you'll be staying, and whether you'll be in rural or urban areas. This will help us schedule your vaccinations appropriately.
Yeah, well, look, I think I'm getting into Bangkok, so I'm there for a week. I'm not going to bore you with Frank's detailed itinerary, but I was very impressed that Dr. Aida did ask about rural and remote because that obviously changes the sorts of vaccinations you need. She even talked about safe sex on the trip as she worked out this was a single bloke heading off to Thailand. So really pretty impressive. This technology is quite new, but an amazing start. Hope you got a bit of a feel from it today.